Next, we have vaccines. As several have mentioned, it's extremely important to have safe and effective vaccines available for everyone in this country, as well as globally. In that regard, we put together, myself and some of my colleagues, and published in Science magazine a few weeks ago, what we call a strategic approach to coronavirus 19 vaccine research and development. It's not a comprehensive plan about every aspect of vaccine, but it is a strong plan regarding the research and development pathway. And what we have done in this is that we have what's called a harmonized effect, because we know there are many vaccines that are in trial now at various stages. And what we did, and the federal government, thanks to the generosity of the Congress, has put a considerable amount of money in order to harmonize the trials of multiple candidates from different companies, so that we have common endpoints, common data and safety monitoring board, and common immunological parameters that are being funded and are being pursued. In addition, there are a number of different platforms that are being pursued so that we don't have all our eggs in one basket. As you know, one of those is right now getting ready as we approach next month of going into phase 3 trials, and others will be staggered along the way in the middle of the summer, end of the summer, early on. There is no guarantee, and anyone who's been involved in vaccinology will tell you, that we will have a safe and effective vaccine, but we are cautiously optimistic, looking at animal data and the early preliminary data, that we will at least know the extent of efficacy sometime in the winter and early part of next year. Again, working with the companies and the investment made by this Congress, hopefully there will be doses available by the beginning of next year. These are the things that we feel aspirationally hopeful about, and we will continue to pursue this.
Our most recent analysis of the United States case data from the pandemic, hospitalizations were 6 times higher and death 12 times higher among those with reportedly underlying conditions compared to those who did not have these conditions. We've expanded the list of underlying conditions where the evidence is clear that they put people at higher risk of severe illness. These conditions include chronic kidney disease, COPD, having a weakened immune system from a solid organ transplant, obesity, serious heart disease, sickle cell disease, and type 2 diabetes. Our analysis also provides further evidence that racial and ethnic populations are disproportionately affected by this epidemic. While data is the backbone of this response, containing the outbreak depends on 4 core interventions: readily available testing, comprehensive contact tracing, timely isolation of known cases, and quarantine to break the transmission. We are not defenseless against this disease. We have powerful tools at our disposal: social distancing, wear a face cover in public, and be disciplined about the frequent hand washing. It is critical that we all take the personal responsibility to slow the transmission of COVID-19 and embrace the universal use of face coverings. Specifically, I'm addressing the younger members of our society, the millennials and the Generation Z. I ask those that are listening to spread the word.
I think that antibody data will help us in terms of the development of monoclonal antibodies. We have a number of sponsors who've come in for monoclonal antibody studies. We are already well into that treatment. Monoclonal antibodies are synthetic antibodies that will provide, that the theory is will provide protection against the infection of the virus. And we're hopeful that those studies by the late summer, early fall will provide us information about their effectiveness and safety.
So you're optimistic that there will be more than one treatment available this fall for teachers, administrators, older adults?
Yes, sir, I'm optimistic.
We've got to make sure that when states start to try and open again, they need to follow the guidelines that have been very carefully laid out with regard to checkpoints. What we've seen in several states are different iterations of that, perhaps maybe in some going too quickly and skipping over some of the checkpoints. But even in states in which the leadership, in the form of the governors and the mayors, did it right with the right recommendations, what we saw visually in clips and in photographs of individuals in the community doing an all or none phenomenon. which is dangerous. And by all or none, I mean either be locked down or open up in a way where you see people at bars not wearing masks, not avoiding crowds, not paying attention to physical distancing. I think we need to emphasize the responsibility that we have both as individuals and as part of a societal effort to end the epidemic, that we all have to play a part in that. And I think if you look at the visuals, what we saw were a lot of people who maybe felt that because they think they are invulnerable, and we know many young people are not because they're getting serious disease, that therefore they're getting infected has nothing at all to do with anyone else, when in fact it does. Because if a person gets infected, they may not be symptomatic, but they could pass it to someone else, who passes it to someone else, who then makes someone's grandmother, grandfather, sick uncle, or a leukemic child on chemotherapy get sick and die. We've got to get that message out that we are all in this together. And if we are going to contain this, we've got to contain it together. The Chinese, over the last week or two, have identified a virus in the environment. It has not yet shown to be infecting humans, but it is exhibiting what we call reassortment capabilities. In other words, when you get a brand new virus that turns out to be a pandemic virus, it's either due to mutations and or the reassortment or exchanges of genes. And they're seeing virus in swine, in pigs now, that have characteristics of the 2009 H1N1, of the original 1918, which many of our flu viruses have remnants of that in it, as well as segments from other hosts like swine. When they all mix up together and they contain some of the elements that might make them susceptible to being transmitted to humans, you always have the possibility that you might have another swine flu type outbreak as we had in 2009. It's something that still is in the stage of examination. It's not so-called an immediate threat where you're seeing infections, but it's something we need to keep our eye out on, just the way we did in 2009 with the emergence of the swine flu. It's called G4 is the name of it.
Let me ask a question that has just bothered me lately. All of you, and I think most Americans, understand how important social distancing is. We're told over and over again, the chairman told us at the beginning of this meeting, stay apart, at least 6 feet apart if you can. And just the other day, however, American Airlines announced that they were going to fill up all of their planes. And other airlines have done the same. So you're going to have people going from New York to California, 5-6 hours, sitting inches apart from each other. And then you got buses all over America where people are kind of packed in like sardines. But my question is, why hasn't the government, whether it's the CDC or the Department of Transportation, issued guidelines prohibiting those violations of what we all know to be common sense? Who wants to, Dr. Fauci, you want to start on that one there?
Thank you, Senator. Well, I'm not the CDC, but I'd be happy to make a comment on that, and maybe Bob would also. I mean, obviously, that is something that is of concern. I'm not sure exactly what went into that decision making. I would hope there would be something to mitigate against that, because I know, as we've said, and I continue to repeat it, that avoiding crowds, staying distance, and when in a situation like that, wear a mask. I think in the confines of an airplane, that becomes even more problematic.
But generally, I understand the mask thing, but doesn't it sound a little bit silly and a little bit in violation of everything you guys have been talking about? To have people sitting next to each other for 5 or 6 hours in an airplane or crowded into a bus. And my question is, why hasn't, the president issues a lot of executive orders. Why haven't we stopped that type of activity and told the airlines and bus companies that is unhealthy?
Senator, I appreciate your question, and I think it's a critical area. I can tell you that when they announced that the other day, obviously there was substantial disappointment with American Airlines. A number of the airlines had decided to keep the middle seat thing I can say this is under critical review right now by us at CDC. We don't think it's the right message, as you pointed out. Again, we think it's really important in individuals that are in, whether it's a bus or a train or a plane, or social distancing to the degree that's feasible, and at least have a reliable face covering. So,
Okay. Well, I thank you, and I just hope very much that the CDC or the appropriate agency basically tells these companies that that is unacceptable behavior. They're endangering the lives of the American people. Let me go to another question. I just have a few more questions, and not a lot of time, so I'd appreciate brief answers. At the University of Washington, the Institute of Health there indicated that if 95% of the American people were to wear masks, we could save some 30,000 lives. A number of countries, including South Korea, France, Turkey, and Austria, have provided low-cost or free masks to all of their people, something that I believe in. Would you support an effort to greatly increase the production of high-quality masks in this country and distribute them free of charge to every household in America? Dr.
Yes.
Fauci or anybody else wants to jump in on that?
Yes, of course. I think masks are extremely important, and we keep hammering home. And I think what you just mentioned is as important. There's no doubt that wearing masks protects you and gets you to be protected. So it's people protecting each other. Anything that furthers the use of masks, whether it's giving out free masks or any other mechanism, I am thoroughly in favor of.
and I just want to echo that, Senator. In my opening statement, I called on an environment that we have universal mask. I think it's fundamentally the most important thing we can do.
That's great. But when you refer to quote unquote universal masks, which I agree with you on, would you be supporting the increased production of high quality masks and basically distributing free of charge to every household in America? Because I think that's going to save tens of thousands of lives. Would you agree?
So Senator Sanders, this is Brett Giroir. Yes, sir, I agree that is very important because we need to support mask wearing. I would also point out that Dr. Cadillac, the ASPR, has contracted for hundreds of millions of cloth face coverings that could be distributed around the country, and those kinds of processes are being thought of. When I'm not in uniform, I wear them. They're white. They work very effective, and I think they're a great investment for the American people.
Good, thank you. My very last question, it's an issue I've raised now for the last couple of months. All of us hope to God that a good, safe vaccine will be developed as soon as possible. But that vaccine may not mean anything to a low-income person who might not be able to afford it. I happen to believe that we should make these vaccines. And by the way, as you all know, federal government, our tax dollars are going to the tune of billions of dollars into drug companies to help develop this vaccine. That's okay. But would you agree with me that after that kind of investment, we should make sure that every American, every person in this country can get a vaccine regardless of their income?
Yes.
Okay. Anybody else want to comment on that?
Yes, Senator.
Yes,
Agreed.
Senator.
Yes, Senator.
Well, good. Thank you all very much.
The numbers speak for themselves. Although we do have a number of parts of the country that are doing well, I'm very concerned about what's going on right now, particularly in the 4 states that are accounting for about 50% of the new infections, but the other vulnerable states. So I'd have to say the numbers speak for themselves. I'm very concerned, and I'm not satisfied with what's going on because we're going in the wrong direction if you look at the curves of the new cases. So we've really got to do something about that, and we need to do it quickly. Short answer to your question is that clearly we are not in total control right now.
Thank you. Thank you very much. You know, our case numbers are getting worse, and our death rates are going to get worse soon. During this same period of time, some other countries around the world have controlled the virus. They're reporting fewer cases each day, and they are able to provide targeted testing and to keep it up so that they can tell what's happening. And and follow up if there is an outbreak. In other words, controlling the coronavirus can be done. But because of bad federal leadership, we have not been able to do this here in the United States. So, Dr. Fauci, the last time you were before this committee, you told me that if the U.S. did not have, quote, an adequate response, that the country would, quote, have the deleterious consequences of more infections and more deaths. Now, I know that we've made some progress, but half measures won't save lives. Dr. Fauci, I'm asking you to be very direct with all of us on this. If we don't fully implement the widespread testing, contact tracing programs, and social distancing practices that everyone seems to agree that we need, can we expect these spikes in infection to keep happening in different places around the country?
Thank you, Senator. I'm always direct with you, and I'll tell you in direct answer to your question that if you look at what's going on and just look at some of the film clips that you've seen of people congregating, often without masks, of being in crowds and jumping over and avoiding and not paying attention to the guidelines that we very carefully put out, we're going to continue to be in a lot of trouble, and there's going to be a lot of hurt if that does not stop. And that
Okay,
gets
so
back-
if we don't get our act together, more and more communities around the country are going to see these dangerous surges of COVID-19. Dr. Fauci, back in March, you also said, quote, looking at what we're seeing now, you expected there to be between 100,000 and 200,000 coronavirus deaths and millions of infections in the US. So let's flash forward to late June. Here we are at the end of June. We've already seen 126,000 deaths with infection rates rising rapidly. Dr. Fauci, based on what you're seeing now, how many COVID-19 deaths and infections should America expect before this is all over?
I can't make an accurate prediction, but it is going to be very disturbing. I will guarantee you that, because when you have an outbreak in one part of the country, even though in other parts of the country they're doing well, they are vulnerable. I made that point very clearly last week at a press conference. We can't just focus on those areas that are having the surge. It puts the entire country at risk. We are now having 40+ thousand new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around. And so I am very concerned.
What is your opinion of how many individuals we need vaccinated and/or having herd immunity before this thing goes into the rearview mirror?
Yeah, Tony may comment on that too. It's really got to be over 70% of the population's got to be immune before we even see any impact of herd immunity.
Dr. Fauci?
No, yeah, I totally agree. Given the transmissibility, which is highly efficient, you're going to need somewhere between 70 and 85%. I would say 70 at the lowest.
Okay. Second set of questions would be on the issue of herd immunity, because, of course, we've got we don't know how long it's going to take to have an effective vaccine. And I'm guessing when you're talking about herd immunity, it's got to actually confer immunity if you get it, and there might be some uncertain. Let's assume you do get the immunity. What is the, how do we go about the approaches that we've used to this point? Is herd immunity going to be something that you think will march through if we take the strategy of having a different approach for younger people that seem to have lower hospitalization rates and less significant consequences? Because I think that's another thing we need to know, because I think that's already going to be done by each individual in a way as they size up their own personal risks. So how much can we count on herd immunity?
I can answer quickly and then turn it to Tony. I think it's important to realize even now we're probably looking at somewhere between 5 and 8% of the American public has experienced this virus. So for me, herd immunity as a basic strategy, you're talking about a multi-year strategy. This is why it's so important that the alternative strategy is a biological countermeasure in the development of a vaccine.
One of the issues that might be complicating, I don't think it's going to be something that is going to be any kind of a showstopper, but we've got to realize, and as Senator Paul said, we have to be humble and know there's a lot we don't know. And what we don't know is what the durability is. In other words, so if you wind up getting herd immunity to 75, 80%, what we need to learn, and only time will teach us this, is how long this immunity lasts. Is it a year, 2, 3, 4, or is it even less? Is it months? We don't know. When we find out, then that will inform us as to whether or not, if you get a vaccine, how often you need to boost it. So we have to realize we don't really know the answer to your question in any definitive way.
At least that gives us some clarity, some parameters to live within. Senator Hassan stressed the point of protecting the most vulnerable, because to me, the one thing it looks like we could certainly do is to take that highest risk group from the data we've already got and build, in essence, an iron dome around them as the one thing that would seem to be the most important thing to do where you get certain results. And I think that has to be in place as the uncertainty of herd immunity and when we get an effective vaccine actually converge.
I might add, we always think about herd immunity with regard to natural infection and/or vaccination. But when you want to talk about protecting the vulnerable, we want to see if some of the other programs that are more prophylactic treatment programs, like passive transfer of plasma or monoclonal antibodies or hyperimmune globulin, those are some of the things that you can do to protect the vulnerable until we do get an effective vaccine.
Thank you.
We don't know precisely. I think the data that was very interesting that Senator Paul showed about school openings and not seeing any real obvious surge in cases is important, but we don't really know exactly what the efficiency of spread is. First of all, how many children get infected? That was the reason why in my opening statement I mentioned the study that we're doing at the NIH of 6,000 families looking at children. What is the rate of their infection and how often do they infect their families? Because if it's true that the rate is down, we know that they don't get seriously ill with hospitalizations when they get infected. But if the rate of infection is down and they don't readily transmit to their parents and family members, that's going to be very important in the decision-making process of opening schools. Hopefully, we're going to find that out reasonably soon by this study that we're doing.